Okay, we're sitting in Querétaro, Mexico, and we came for the measurements of my treatment that I decided to do with Dr. Garcia. And I just want to introduce you to, in our opinion, the dentist who has credentials, has experience, has a wonderful background with the schooling in the United States, speaks both languages, and we have a lot of happy friends, clients, patients who came, who experienced the treatments with the dentist.
Another patient, which I place 8 implants on top.
Okay.
Okay, these 8 implants that I place, I'm not gonna show you all the surgery because I don't wanna.
Right.
I'm just gonna show
Scare
you
the
the
patient
lab
off.
part and how everything looked.
Okay.
These are the abutments parallel to each other on the implants on the top and on the other side. There are 8 implants placed right there. As you can see it there, don't worry about that. This is just to see the height and the models, and I'm seeing that the bite is right on. Okay, I'm working against what he has on the bottom. Okay, so what I did is pretty much find out exactly the access holes, make the abutments exactly the way I want them, and that's a final prosthesis. So when we finish this, everything looks like there's nothing missing, and it's completely fixed. And if you can see that smile,
Happy patient.
and without any problem.
Right.
These are cases for a full mouth rehab with 8 implants. You can go 8 or 6 implants. Now, if you want something that is less demanding and a little bit not as pricey as this, you can do 4 implants. And it's not only dentistry, it's dentistry and implants, veneers. You can come for 3 different types of cleaning. It's a lot of possibilities that a lot of people in US are not aware that the services are top-notch in quality and very comparable in prices.
Thank you.
A lot of patients coming from US.
Very good. Yes,
Okay.
I have a big pool of patients coming from the US. I'm Dr. Isaias Garcia. I did my training in Indiana University. I'm a prosthodontist. I do a lot of restorative work and aesthetic dentistry. I have a team of dentists that work with me for root canals and periodontics and anything that I do not do. The team has been together for over 20 years. So we know what we're talking about. We're talking about veneers now. The veneers that I'm going to be doing is going to take me 10 days to have them ready. On the first visit, it's going to be a long visit in which is going to be 2 hours visit, so I can work on it. And I'm going to be giving her temporaries. Those temporaries come from a mock-up that I already did for her.
Right.
And in 10 days, she'll be beautiful.
Smiling.
Smiling. She's already beautiful, sorry, with better teeth, I'm sorry.
Thank you. So that's the service with veneers, because a lot of our friends are asking for that kind of treatment, and implants. Implants is number one scary thing in America because of the prices.
Sure.
And the amount of sometimes not the professional work where the doctors, I've heard all the stories, are not checking the background, the bone structure, whatever. It's a foundation of the treatment.
Sure. The first thing we do with implants is, now that you mention it, we need a 3D scan. The 3D scan would tell me the density of the bone, the height of the bone, and I would know if there's any problems within the patient before even talking about implants. Usually doing an implant in this office, we do at least 4 to 5 a week. So we do a fairly good amount of implants. We do an all on 6, all on 8, all on 4 techniques. And all of those people are very, very satisfied when I'm finished with them.
What's the shortest time for the implants?
Well, let's say you're missing a front tooth. If you have sufficient bone, the same day that we place the implant, we go ahead and we load this implant with a temporary, so the patient would leave with a tooth immediately after the appointment.
Oh, Oh, wow.
If this is something that is on the back of your mouth and you're missing, let's say, a first molar and you want to have this molar replaced, it's a different story. Why? Because you're chewing everything with your back molars. So we would have to place this implant first and leave this implant for the amount of 2 months, 2.5 months, for this implant to be completely integrated. And after that, we'll be able to give you the final restoration, which is the crown.
I understand that every single case is gonna be individual, so it's hard to
Correct.
determine how much time we need.
The only thing I can ask you to is take a 3D scan.
Okay.
With that 3D scan, I'll be able to see it, and I could tell you exactly how much time you're gonna need, and if you need some other stuff. Like what? Maybe if you're placing an implant on the bicuspid area, maybe you need to have a bone augmentation procedure. But that I would not know without the scan. So
Right.
it's something that is very important. The other thing that we need to consider is the type of gum that you process. Why? Because there's some people with very thin gum. So when you have an implant and you just place an implant, and you don't place it deep enough, what's going to happen is you're going to show the metal of that implant.
Oh, wow.
So it's sometimes you need to do a grafting of the skin so we can cover that up. How would I know that? Give me a 3D scan so I can tell you.
You don't want to see through implants or see through gums.
No. There are also different types of implants that we can do, metal-free implants, which are made of zirconium. It's just there are different possibilities that I need to consider, and we can talk about that also.
Is there anything, this is out of curiosity, maybe I shouldn't be even asking, is there anything better or anything different that other dentists might do in the US besides the pricing for the implants? Like, what is so significant about doing implants here, based on your experience?
What I can tell you, I graduated 20 years ago, and I've been doing this for 20 years as certified prosthodontist. I can tell you that everything that I can give you here, I have many patients that already have received my treatments and went back to the United States for a checkup or anything. And I can tell you that dentists are impressed with what they can get here in Mexico. As far as treatments, we can get everything that you can get in the US or any other part of the world. We can do it here in Mexico. We have a very nice pool of training dentists to work with. It's not a problem at all. Anything at all.
Okay. Any other treatment that you would mention, which is the most popular for people who are traveling overseas?
Well,
Because I know the percentage of your patients you mentioned is like 95%, which is globally a lot of patients, a lot of clients coming
sure.
from the other countries.
They would like to come in for aesthetic dentistry. They do a lot of bleaching. We have three different types of bleachings. We do a lot of veneers. We do a lot of crown and bridge, depending on each patient and different needs. But the most popular one, I can tell you that right now, is doing the all-on-4 technique with implants. There are many people that are coming because they have needs of having their teeth back, in which on the same visit we place the implants and we place a temporary denture on top of those implants, and people are very, very satisfied. After 2 months we can deliver the final work, and I can assure you that's excellent work.
We're here, basically every single patient is gonna be an individual case, and for sure any dental work, the previous work, x-rays, 3D scans, everything is gonna be needed or helpful for you to give any estimate or any advice or expertise,
Sure.
whilst the clients are still on the other side of the globe.
Every people have different needs. If you already know your needs, what you need is give me a 3D scan,
Okay.
and with that send it to my email, and I'll be able to see it.
Okay.
And I can detail for each patient what they need,
The
so I
service.
can send you exactly how much money you're going to be spending, how much time you need for that work, and I can also send you some pictures of some of my work so you know the results.
Right. We're doing it for one main reason. We've been here for so many times already, and I kind of fell in love with this country as second opportunity. First of all, it's pretty much close to United States, and I was impressed by the quality and the services that they're offered here in Mexico. So we're trying to show this country from totally different perspective. We're doing this as a side job hobby, having vacation every single time, enjoying the temperature, clima, and of course meeting a lot of extraordinary people. But for the medical services, every single person who comes the first time is impressed.
Sure.
Because everybody thinks that only in the United States, some people traveling to Europe, which is 3 times more expensive. So that's why whoever is interested, I think we're building like a chain of possibilities and opportunities for people who are really seeking, because some of you might have a tight budget, and I think buying a ticket, like sometimes we find a deal for $200-300 back and forth.
Sure.
It's so worth it. So make a good decision. Any questions, we're gonna be back with my progressing project.
Excellent.